Hi Thomas, it's Kai. Thanks for reaching out about Peter. I know this is a really tough spot, and I appreciate you trusting me to help think it through. So here's how I see it. We've got Peter who needs a liver transplant but doesn't have insurance and he can't pay for it. His daughter Lisa, is doing everything she can, fundraising, getting the word out, and pushing for help. And the doctors are on board and want to see Peter get the transplant because they think that he'll make it through if he gets a chance. But they're also worried about how this might look if it turns into a news story, and they're hoping that finance can step in before it gets messy. And then there's you, stuck trying to balance what's right for the patients, like Peter, and with what the hospital can actually afford. So there's a couple things making this complicated. First of all, if the hospital pays for Peter's transplant, it would definitely open the door for other people to come ask for the same treatment and the same help, and that would stretch the hospital's resources and make it hard to help anyone at all. Secondly, there's always that push and pull between the hospital's mission to care for people and the reality that you need money to keep the lights on and things like that. You got to pay people, and for-profit healthcare means sometimes the money side gets in the way of what feels right or what the right thing to do ethically is. So here's my suggestion. I think it's important to be honest and be ethical, but yeah. So one of the suggestions I had was maybe the hospital could set up a special fund for cases like Peter and use a mix of community funding, like hospital charity, and things like that. And that way, the hospital isn't taking all the risk, but it's also not turning away someone that could potentially benefit a lot. And I mean, if you were to do this, it would help to have very clear guidelines when this kind of help is offered, so not everyone can apply for it. And at the same time, I think hospital needs to be very clear about what the limits are for this kind of treatment. Like, you can't help everyone, and you shouldn't pretend that you can, but you still want to help the most amount of people possible. So this is the kind of dilemma that you're in. But by making sure that you're clear about, yes, we will help these kinds of people with these kinds of financial struggles and things like that, uh, it's easier for you to make harder choices. I don't think there's a perfect answer here, but I think a balanced approach between fundraising, uh, making sure that your policies are clear, and using honest communication lets you help as many people as possible without putting the hospital at risk. So yeah, let me know what you think, and I'm always here if you need it.